Hello and welcome back to Seasoned and Bold. Today, we're tackling a topic of immense importance, a condition that strikes fear into many hearts: stroke. Stroke is a truly formidable disease. The mortality rate is close to 20%, and a disability rate of 30 to 40% means it leaves a devastating impact. The very word stroke means a sudden attack on the brain. It refers to conditions where the brain is suddenly damaged, excluding external trauma. The primary causes are sudden vascular issues: cerebral infarction, ischemic stroke, where a blood vessel gets blocked, leading to tissue death, or cerebral hemorrhage, where a vessel bursts. The critical importance of early intervention and golden hour. One of the most unfortunate aspects of stroke is when early treatment is missed. Many patients could have significantly recovered or even fully returned to normal with prompt, appropriate care. This brings us to the crucial concept of the golden hour. This isn't just a general period. It means there's a decisive treatment available that can completely restore the patient to normal, even after neurological damage has occurred. For intravenous thrombolysis, this window is 4.5 hours. For procedures where a clot is directly removed from the brain, it's about 6 hours. You might wonder if treatment is impossible after this time. The procedure itself can still be performed, and the clot can often be removed. However, the problem is that brain cells will have already died. Unlike liver or skin cells, brain cells have almost no regenerative capacity. From the moment we're born, those are the brain cells we have for life, and they only decrease with age. During a stroke, a large number of these vital cells die instantly. Brain cells are incredibly fragile. Blood flow interruption for just 30 seconds to 1 minute can cause them to start dying. Once dead, they turn into scars. The longer the blood vessel remains blocked, the larger the area of dying brain tissue becomes. So, the golden hour doesn't mean you have 6 hours to simply reach a hospital. It means the earlier, the better. The sooner you arrive and receive treatment, the higher your chance of full recovery, especially for ischemic stroke. If there's a hospital capable of treating stroke within 6 hours, you must reach it as quickly as possible, as if your life depends on it. Debunking stroke warning sign myths. Now let's address some major misconceptions about stroke warning signs. Many broadcasts and YouTube clips provide incorrect information. Common examples include people mentioning long-term headaches, chronic dizziness, feeling unwell, lack of energy, eyelid twitching, or a weak feeling on one side of the mouth. However, stroke patients typically experience a sudden onset of neurological symptoms. Chronic, long-standing symptoms are generally not stroke-related. For instance, many people believe headaches are a sign of brain blood vessel problems. This is scientifically incorrect. The brain itself does not feel pain. Pain is felt by the meninges, membranes outside the brain, or the walls of brain blood vessels. Most headaches are due to dysfunction in brain blood vessel movement, pressure on the meninges, or muscle tension. So, the majority of chronic headaches are not warning signs of stroke. Another common misconception is about tinnitus, ringing in the ears. While some rare stroke cases might involve sudden hearing issues or strange tinnitus alongside dizziness, tinnitus alone, without other symptoms, is generally not a sign of stroke. Most tinnitus is related to age-related hearing loss, where auditory cells become overactive trying to hear. So, if you're only experiencing chronic headaches or tinnitus, there's usually no need to suspect stroke. Recognizing true warning signs and stroke symptoms. The truth is, a stroke is, while warning signs are the exact same as actual stroke symptoms, but they resolve on their own. This phenomenon is known as a transient ischemic attack, TIA, where a blood vessel temporarily blocks and then fortunately clears. If you experience these symptoms, even if they disappear, you must go to the hospital immediately. This is because it indicates underlying arteriosclerosis, a precursor condition where a clot formed and then dissolved, meaning it can happen again at any time. Don't mistake it for just feeling a bit off, a dream, or a simple misperception. So what are these critical stroke symptoms? They typically come on suddenly and severely. Weakness or paralysis on one side of the body, for instance, inability to lift an arm or leg. And sensory disturbances on one side, for instance, feeling like a part of your body is not your own. And sudden difficulty speaking or understanding speech. Sudden blurred vision or loss of sight in one eye. Sudden severe dizziness leading to staggering or difficulty walking. If these symptoms appear abruptly and intensely, it is most likely a stroke. And if they appear and then disappear, that's a warning sign, meaning you've had a lucky escape for now, but the danger is imminent. What to do and not to do during a stroke emergency. When a stroke occurs, many people, especially family members, often try to help in ways that are actually ineffective or even harmful. We've seen many people try these things, pricking fingers or toes with a needle, massaging arms and legs vigorously. Let me be clear. These three actions provide no benefit and can even be harmful. A stroke means brain cells are dying, not that the limbs are dead or lacking blood flow. Pricking fingers does nothing for the brain and carries a risk of infection. Giving something orally can be dangerous because stroke can cause swallowing difficulties, dysphagia. Food or medicine might enter the windpipe instead of the esophagus, leading to aspiration pneumonia, a serious complication. Massaging limbs is similarly useless. The problem is in the brain, not the limbs. So, what should you do? 1. The absolute first thing is to immediately call 911 or emergency services. Don't try to drive the person to the hospital yourself. That often causes delays and is counterproductive. 2. If the patient appears to be about to vomit, simply gently turn their head to the side. 3. Beyond that, do nothing else. Any other action could be detrimental. It's important to distinguish this from cardiac arrest. If someone collapses suddenly, grabs their chest, and loses consciousness, that's likely cardiac arrest, and CPR is critical. With cardiac arrest, the heart stops, cutting off blood flow to the brain, causing immediate loss of consciousness. However, with a stroke, the patient usually remains conscious but has neurological deficits. If they are conscious but exhibiting strange symptoms, call 911 for stroke. Do not perform CPR. Prevention. Understanding your risk factors. Stroke isn't a disease that suddenly appears out of nowhere, especially not in a perfectly healthy person. It's the culmination of years of underlying issues. There are 4 stages in health in terms of stroke. Stage 0, healthy person. Stage 1, person with risk factors. Stage 2, person with arteriosclerosis, hardening of the arteries. Stage 3, person who has experienced heart disease or stroke. A stroke in stage 3 means a person has unknowingly been loading the gun for 5 to 20 years. This loading phase, scientifically, is when arteriosclerosis develops in the blood vessels. This isn't a random disease. It's a direct result of poorly managed high blood pressure, diabetes, high cholesterol, heavy drinking, and smoking. These factors damage the inner walls of blood vessels, creating scar-like changes. Arteriosclerosis is like having the gun loaded. You can live with it for a long time without a stroke if you don't pull the trigger. The trigger is pulled when the inner lining of a blood vessel ruptures or a clot forms. This trigger can be pulled without warning, but often it's linked to specific situations, extended overwork or chronic lack of sleep, and sudden, intense, unaccustomed physical activity, and periods of extreme emotional stress or grief. While we can't avoid all life stresses, the most important thing is to know if your gun is loaded. This means being aware of your risk factors like hypertension, diabetes, high cholesterol, and whether you've managed them poorly, potentially leading to arteriosclerosis. Understanding your personal risk is crucial for prevention. In summary, stroke is a medical emergency that requires immediate action. Learn the true, sudden neurological symptoms, and if they appear, even if they resolve, call 911 or any emergency services without delay. Do not attempt unproven home remedies. Most importantly, be aware of your health. Manage your blood pressure, blood sugar, cholesterol, and avoid excessive smoking and drinking to prevent the loading of arteriosclerosis. Your brain is precious and irreplaceable. Protect it by being informed and proactive. Thank you for watching, and please like and subscribe. It will help us to create more videos.